Welcome back to Chokitable Media.
Health sector, like every other sectors in Nigeria, are in comatose, if not to say they are dead. Wait a minute, who actually knows the present Minister of Health in Nigeria? If you know him, can you just tell us his achievement, his name, probably his pedigree as well, and his stewardship since they've appointed him to be a minister under this current administration? The president of Nigeria this week made a trip down to the UK on medical treatment. They say it's an holiday, but definitely he will definitely see his doctors. And since he assumed the position of the president, he's been traveling out to go and receive medical treatment one way or the other in France, in the UK as well, and sometimes in the Arab world. The politicians of Nigeria, they never think or thought it wise to fix health sector in Nigeria in their own home. And there was never a time I heard it in the news that the president of other countries used to travel down to Nigeria to come and receive treatments. Yes, it happens once. Yes, that I remember, but I'm talking about present day Nigeria, because gone are the days when people all over the world used to come and visit, come on medical tourism to come and treat themselves and their families in Nigeria. That was when the going was good. But these days, the story is not the same. Health sector, like every other sector, are basically dead. And this current week again, we saw and heard in the news that alumnus of UCH in Ibadan, the University College Hospital in Ibadan, came down to donate a huge amount of money to revamp that institution, that hospital, which used to be the pride of Nigeria in those days. And this is actually not the first time they are coming to drop a huge amount of money to help that hospital to come back to life. But how long? How long will this go on? Donation left and right. We are not saying it's not good to help your schools, your alma mater, to donate. But this kind of donation, will it sustain that place if there's no good governance? And I remember there used to be budget every year, earmarked for health sector. And the question is, where are this money going to? Who is spending the money? How are they spending the money as well? This is a very good question for us to answer, so that at least we will have trust in our own health sector or all the other sectors as well, so that all the politicians that are supposed to show good example will sit back at home and receive treatment in their own hospital. They are building hospitals, or they have hospitals which they cannot even attend for treatment. They prefer to come outside to come and receive treatment. In other countries, they trust other hospitals, yet they subject Nigerians to the hospital in Nigeria. The same thing in the education sector. How long will this go on? I found a video from Adeola Fayehun in the US. I think she met the current Minister of Health. I don't know where, but I would like you to listen to the interview given to the man that is the current Minister of Health in Nigeria. Let's listen to them and their discussion. And I want you to note one thing: the defense of Tinubu as an individual, that he has the right to travel to go and receive medical treatment anywhere he wants. See, there is a standing hospital called the Aso Rock Clinic. I think the question should be asked as well: what happened to Aso Rock Clinic? Are they not using it again? how much budget was given to this hospital, this clinic in the Aso Rock? How much has it got since they built one in there? And why can't the president and the family of president to use this facility? Well, I don't know much. I'm just trying to wake our thinking, wake our intelligence, and let us also think. We all know what is good, and we all know when something is wrong. But the politicians will never see that this is, whatever they do is wrong. They only believe what they do is right. Yeah, it calls for a great concern. A president of a country is out to go and receive treatment in another country. You sell rice at home, or your mother sells rice at home, but you can't eat your own rice, the rice that your mother sells, and you prefer to go and buy rice. From another mother in the market. What do you think people will think about you? The last time I saw the president also hiding there in the hospital in the UK, his hates were trying to hide him, but fortunately he was caught up in the camera, and we all saw the video. This is Chokitebo Media. Listen to the interview from the current Minister of Health in Nigeria and listen to his defense. Bye for now. See you next time.
Hi guys, sorry that I'm shouting, but there is music in the background. But I'm here tonight with my father, the Minister of Health, Alhaji Ali Pate. Daddy, thank you so much for granting me an audience. Real quick, Daddy, as the Health Minister, do you receive all your medical treatments in Nigeria?
Yes, I do. And I believe that we're building a healthcare system to be one that Nigerians can feel comfortable, that they will be receiving safe and effective services. We have begun an investment to establish 6 cancer centers in each of the geopolitical zones. We have many gaps, but we're working hard to ensure that we minimize those gaps and we continue to improve, to rebuild Nigeria's healthcare system that we can be all proud of.
So Daddy, not even for checkup, you don't come abroad for anything, all your treatments is done in Nigeria?
I do my best to eat well. I try to exercise, and so far, thank God, I am healthy.
So that is a yes. All your medical treatment.
My doctor is in Abuja. I can give you his name, his address, but I will not do it here.
That is very impressive.
Yes.
Hopefully, other government officials can emulate you. But real quick, Daddy, as the Health Minister, does it bother you at all? Do you ever feel like you failed as the Health Minister when the President keeps going abroad for treatment every few months, including for something as simple as medical checkup, just regular checkup? Does it ever bother you as the Health Minister?
Adeola, I think you are simplifying a very complex issue of tourism. There are many kinds of tourism. People travel all over the world for education, for conference tourism, for religious tourism, for medical tourism, for all kinds of tourism. Health tourism is not a phenomenon that is limited to Nigeria or Africa. There are people who leave the United States and go to East Asia to get medical care. There are people who leave the United Kingdom and go to Africa for medical care. And there are Nigerians who choose, because of all kinds of reasons, to go abroad for medical care. The question you should be asking is, how is our healthcare system addressing the basic needs of our population? Immunizing kids, protecting women from childbirth so they deliver safely, delivering basic treatments of things like malaria, and for higher levels of service, provide the option for those who choose to have their services in Nigeria to have high quality services delivered in Nigeria. That is what we are trying to do. So the red herring of really targeting medical tourism, I think it's a misguided
So Daddy, it doesn't bother you that the President is going out. It bothers the rest of us that he's going abroad for treatment. It doesn't bother you.
$2 billion that Nigerians spend in outbound medical tourism. Private individual, public individual, everybody.
So, but the President is supposed to lead by example.
Yes, I'm telling you this, that our effort is to ensure that the $2 billion in outbound medical tourism is retained in Nigeria. When people go abroad, they go to private facilities not public facilities. When people go to the UK as private individuals, they need private facilities. So how do we stand up private facilities also in Nigeria that can deliver the service? And how do we guarantee that every Nigerian should have access to the most basic healthcare available?
So are you saying that someday people from all over the world will be coming to Nigeria for medical treatment as well?
As we speak, there are many leaders and people from the African region who come to Nigeria for medical treatment.
Really?
Yes, they are.
So what will it take for our president to see what these people see in Nigerian health sector?
You are in personalizing it with just one individual. The phenomenon of medical tourism.
The president of the country.
The phenomenon of medical tourism is a global phenomenon, and you cannot limit it just one individual. What we are saying and what President Tinubu is trying to do is to transform Nigerian healthcare system so that it works for everyone.
Okay.
To save lives,
Daddy,
to reduce physical and financial
I'll ask
pain.
my next question, but
Yes.
just so you know, my conclusion is you have never talked to the president about the importance of him fixing the health sector of the country so that he can. Have you ever talked to the president that as the number one citizen, sir, you should be receiving treatment in your country? This is what we need to do.
I can just tell you straight up that in the last 24 years, Nigeria has not seen a president that is determined to fix its healthcare system as this president.
And he can't even do checkup in his country, but he's determined.
See,
that
you can speculate as much as you want.
Daddy, listen to yourself.
Adeola, you can
He's the most determined.
You can speculate as much as you can. I'm not his physician,
I'm not
so I can't speak about
speculating.
that. But what I'm telling you is that Nigerians spend $2 billion in outbound medical tourism. They spend a lot more in
Because-
education tourism, in all kinds of developmental tourism, and you're not talking about that. On the health side, we're fixing Nigerian healthcare system that people don't have to go to Egypt for cancer treatment.
That's good.
That they would have access to the most.
I really
By the
admire
way-
that.
By the way, there are many people who, in fact, the miracle of vaccines to protect their children against measles is still work in progress, and we're trying to fix it. There are many women
So
who
hopefully
don't have skilled
someday
birth attendants.
Nigerians will stop going abroad, and hopefully it will get to the president as well that someday you should be proud.
This president is just 1 year in office, and he
Yeah,
began
but
to put in place
The
the
moment
building
the
blocks.
Nigerian president is confident in being treated in Nigeria, you should be proud as the health minister
What evidence you have that
that he travels abroad for treatment that like have the fear of God.
Adeola-
My last question, because I know they are saying that time is up. Are you doing anything, sir, because you say you don't want medical doctors to go abroad to practice, which is great. You want people to have easy access to medical doctors all over the country in Nigeria. But are you also doing anything? Are you putting any policy in place to prevent politicians from going abroad? Because a lot of Nigerians believe that is what will fix the health sector if they are forced to receive treatment in their own country.
I think you misunderstood the policy. You took it upside down. What we're saying is everyone has the right to travel anywhere they want.
To go and work?
To go and work, to go and study.
Including Nigerian doctors and nurses?
Yes. But
Nigerian doctors and nurses, you are free to
what
leave the
we have
country.
done, what this president has done is approved a workforce migration policy for the first time in Nigeria, which talks about incentives to keep them, enabling their work environment, providing enablements for their
That is all
capacities
the
to build.
incentives did not include
expand the
increasing
training.
their salary.
Look, I think you're picking elements
does it
to
include
build the
increase?
narrative.
It doesn't include increase in their salary.
Of course, the issue of adjustment of allowances are still in consideration.
So it's
And
considered.
in fact, we tend to look at the most simplistic solutions for a complex issue. There are not enough health workers in Europe. There are not enough health workers in a remote part of the United States.
in Nigeria.
And globally, there's a shortage of health workforce. So what we're saying is let's train more, so that if some leave, some will
let's
stay.
increase their salary too. But the question
Yes.
is, are you doing anything to prevent government officials? Are you doing any policy to force them to be getting treatment in their country?
Are we doing something to prevent people from seeking educational opportunities abroad? So you have to understand, you have to have the health system that is well funded, is able to provide quality services. That is the best way to keep the $2 billion in outbound medical tourism in Nigeria. That's what we're focused on. Not only from politicians, but private sector leaders, everyone, to be comfortable. And in fact, to attract others from Africa, from other parts of the world. It is possible. We're not there yet, but we're working to do that. And we have to, that's the hard work that we are doing under this president.
Thank you so much, sir, for granting me. They've been telling him to leave. Says, guys, appreciate my father. At least he granted others. He may not like the questions, but that is a very great somebody.
Thank you for watching. If you're new to this channel, consider subscribing so you won't miss out on our latest video.